Now, during the past legislative session, there was much discussion about adverse childhood experiences, which is also known to many as ACEs, the acronym. And if you could just explain what is ACEs and how does it differ from previous screening tools that have been used?
So the ACE is a tool, Adverse Childhood Experience, and it's a tool that looks at what has happened in a person's life, primarily in childhood, that may have provided a level of adversity, something that they had to overcome when they were a child.
Mm-hmm.
And it looks at things like poverty, abuse, neglect, parental divorce, food insecurity, housing insecurity. Those are some of the questions that the ACE tool looks at. So as a tool, it gives us a score. But what I really like about that tool is it allows us to look at the way we provide care differently. So we know that if people score high on the ACEs, we know that they are more likely to have health issues as adults. Mm-hmm. Health issues could be asthma, could be COPD, diabetes, obesity. So if we can limit those traumatic events, those adverse events that happen in childhood, we can actually mitigate some of the health concerns that people will have as adults. And so it gives us a chance to kind of, again, develop our service delivery structures to mitigate some of those.
And I would imagine, Todd, that there are many, even those that we collaborate with, who don't realize that NCSS is now immersed in ACEs and that it's just part of what we do.
When you think of the way we provide care, we have already shifted significantly towards a more proactive model of care. How do we intervene early to keep people well? Some of those things I think that we've done is we've looked at developing our models. I met with our CRT program. That's a program for adults with severe mental illness. Mm-hmm. And we actually went around the room and people kind of were reporting out on some of the work that they did. And they talked about maybe 15 situations, 15 individuals that they were helping. And we often think of behavioral health as how do we mitigate symptoms of mental illness. But what we found when we went around the room, much of the work that people were doing was really around things like housing stability, giving people community connections, giving people, make sure they had food security, enough food to eat. And when you think about, when we talk about our services, we often don't talk about those things. Yeah. But those are really the cornerstone of a lot of what we do as strategies to help people stay well. Other types of programs that we would do are our developmental services mm-hmm. division. Mm-hmm. I had an opportunity to meet with our standing committee just last week. And one of the things that they are incredibly proud of is that their peer supports. And that's a way that they've created the system to provide peer support to each other as a way to kind of alleviate loneliness. And if people have more connections, we can build a more resilient community, and that again is a way to intervene to help people stay well. It's worked so well that they actually want to expand that and actually move towards helping people stabilize even in crisis through just peer contact. And those are just some of the types of approaches that I think we're developing as a way to, again, move our services upstream to be mm-hmm. more proactive mm-hmm. and address some of those adverse conditions that people have in their lives.
Mm-hmm. And